Hey y'all. So I had malaria for my individual case study, or I chose malaria rather. Um, and malaria is caused by a protozoan parasite, which is carried by mosquitoes. And so mosquitoes are the main um, transmission vector between humans and the protozoan parasite. There's four types of human malaria, and they're all in the genus of Plasmodium. The two most common, though, are Plasmodium vivax and Plasmodium falciparum. The most common place in the world for malaria is in Africa, specifically the sub-Saharan, South Saharan region. This region is also the region with the highest mortality rate for malaria. And then the symptoms usually show up about 9 to 14 days after you were bitten by an infected mosquito. But this varies per species of or strain of malaria. And the typical symptoms are fever, headache, vomiting, and other flu-like symptoms. And if drugs aren't administered to the infected person, or there aren't drugs in the area that are being used to fight malaria, like against the protozoan parasites, then it does not take very long for the malaria to become very life-threatening. And the way that malaria kills is by infecting the red blood cells, and it clogs the capillaries leading to your brain or any of your other vital organs. And according to the World Health Organization, there's about 250 to 300 million cases worldwide of malaria every year. And the deaths are on the way down, so that's good. But there's usually 200 to 300,000, 200 to 400,000 deaths per year due to malaria. So in about like the 1960s, around there, malaria had thought to kind of gone away and not be as threatening to humans as it used to be, but it has resurged again, starting in the 1970s, and since then it's just doubled and doubled in its cases and deaths. And the cause of this is those protozoan parasites have become resistant to anti-malarial drugs. They have they've become resistant to the drugs. The health programs in these countries, which reflect the poor political structures of these countries, have not helped either. And kind of an example of that is the movement of settlers, or the example of One Health or Emergence. Is in Brazil from 1970 to 1990, the cases of malaria increased by tenfold in 20 years, just because people moved to kind of forested areas in Brazil. There is actually a zoonotic strain that has been discovered of malaria. There's not much research on it yet, but there is a zoonotic strain. And the World Health, as in prevention, World Health Organization suggests insecticide-treated mosquito nets and indoor residual spraying, just to keep any kind of bug down that might be carrying some kind of disease. As for like countries and governments and how they're responding, most of the countries who have a high burden, a high infection rate, aren't really doing much. kind of like I mentioned before, they have poor political structures. Their priorities are elsewhere. They just are not in good shape. Even though the World Health Organization has a structured system, surveillance system, up and available for all these countries to use. They also are working with these countries as much as they can. They don't have the largest resource pool either. There's only so much funding for these programs, but the World Health Organization is working with countries to lower incidence rates and infection rates by 2030.